My name's Keith Duncan. I'm a specialist in high-risk obstetrics and antenatal care in general, and so I thought it'd be useful to give a brief outline of what's involved in having private antenatal care and delivery. Personally, I deliver all my patients at the Portland Hospital in central London, and I offer a seamless care throughout from the start of the pregnancy, where I advise an early pregnancy scan to look at the number of babies to make sure that the viability is okay, and then we do your NIPT. At 10 weeks I do the combined screen looking for early abnormalities and assessing the nuchal translucency. That's performed at 12 weeks, and then I perform an early anomaly scan at about 16 weeks, where we can look in detail at the major structures of the baby, in particular spina bifida or major heart conditions or brain conditions. From then we do the routine anomaly scan at 20 weeks, and then I see you every 3 weeks until 32 weeks, and then every 2 weeks until delivery. And during that time, the first half of pregnancy is normally making sure that baby's okay from a genetic and structural point of view. Second half of pregnancy is mainly looking at baby's growth and development, and also checking mum for important conditions such as preeclampsia. We check your blood pressure and urine on every visit, and we do a glucose tolerance test at 28 weeks to screen for gestational diabetes. And during that time we can look at the size and the position of baby, and we formulate your birth plan along with your antenatal classes to give you the birth experience that you are looking for. It's not vaginal birth at all costs. However, I am as happy as doing a normal birth as I am a caesarean section, and more women, many women often require a little bit of help from a vaginal birth with forceps or Von-2s, but we talk about the possibilities of that. I then continue to look after you after the birth and deal with any complications. I see you for an early postnatal check, and we round that off with a final check at 6 weeks. All my patients have my WhatsApp, so that they can contact me with any urgent concerns or further questions, queries. And basically I'm always around and can look after you seamlessly throughout the whole of the pregnancy.